Good day, everyone. Welcome to this course, GE Sci 1A Understanding the Self, Part 1, Week 7. For this week, our topic would be about sexually transmitted diseases under the topic, the sexual self. I will be your instructor this week, Ma'am Sheila T. Kagimbal. Before we begin, let us first pray. Almighty Father, we acknowledge your greatness over all creations. Grant us wisdom, knowledge, and understanding as we're going to have our class today. We pray that you be glorified in everything that we do. We give back all thanksgiving and honor unto your holy name. Amen. Our learning outcomes for this week are: first, identify the different sexually transmitted diseases and demonstrate the ability to use interpersonal communication skills to enhance health and avoid or reduce health risks. Before we begin with the discussion, let's put on our thinking cap and try to answer these questions. First, name some common STDs or sexually transmitted diseases that you might know. How do you think do these diseases spread? Second question, although anyone who's sexually active can get an STD, certain behaviors can put people at a higher risk. What do you think are they? What are some behaviors that can reduce the risk? And what's the only behavior that can eliminate the risk? If you want to answer the questions, just write your answers on the comment box below. For this lesson, we will be watching a curated video from youtube.com. Posted is the reference. Now, this is the video for this lesson. Do watch the full video to get the concepts included in this lesson.
In the last lesson, we discussed some of the risks associated with engaging in sexual activity. This lesson will hone in on one of those risks in particular, sexually transmitted infections, or STIs. Sexually transmitted infections are sometimes more commonly referred to as sexually transmitted diseases, or STDs. The difference between these two terms is that having a disease means you are showing symptoms of an infection. Sometimes people can have an infection and spread it without actually showing any symptoms. Sexually transmitted infection is therefore a broader term that includes both those individuals who are infected and don't show symptoms, as well as those individuals who have the disease. For the purposes of this lesson, we will use the term sexually transmitted infection, or STI. Sexually transmitted infections can be viral, bacterial, protozoan, or parasitic in nature. This distinction is important because it determines how the STI is treated. Viruses are tiny infectious agents. They are not considered living organisms, but they do possess one characteristic of living things: the ability to reproduce. In order to accomplish the task of reproduction, viruses invade host cells and hijack their cellular machinery. In this way, they are able to multiply and can then be spread through the air, contaminated food, animal bites, physical contact, and through bodily fluids. Viral infections have no cures, but they can sometimes be prevented with vaccines or controlled with antiviral medications. Bacteria, in contrast to viruses, are living, single-celled organisms that can reproduce without the use of a host cell. Bacteria can be found everywhere on the planet, from the air to soil, water, and even inside your body. Most bacteria do not cause disease, and some can even be helpful. A small minority of bacteria can cause diseases, which can be spread in much the same way as viruses, through air, contaminated foods, animal bites, physical contact, and through bodily fluids. Unlike viruses, bacterial infections can be treated with antibiotics. Antibiotics are not effective against viral infections because viruses lack the physical structures that antibiotics target and destroy. Protozoans are another type of single-celled organism. STIs caused by protozoans can be treated with special types of antibiotic. STIs that are parasitic in nature are caused by multicellular organisms like tiny insects or mites. These infestations can be treated with lotions, shampoos, and sometimes oral medications. There are over 20 different sexually transmitted infections. We will discuss some of the more common STIs, their symptoms, treatments, and how they can be prevented. The most common viral infections that are transmitted sexually include HIV/AIDS, herpes, and human papillomavirus or HPV. HIV stands for Human Immunodeficiency Virus. This virus attacks the cells of the immune system, thus compromising the body's ability to fight infections. If left untreated, HIV can completely destroy the immune system and can eventually lead to acquired immune deficiency syndrome, also known as AIDS. This syndrome is a collection of symptoms that occurs when the immune system is so weak that it cannot fight off other infections any longer. AIDS is the final stage of an HIV infection, which can lead to death. HIV is spread through contact of bodily fluids, including blood, semen, pre-ejaculatory fluid or pre-cum, vaginal fluids, anal fluids, and breast milk. Therefore, an individual can contract HIV by having unprotected vaginal, anal, or oral sex, and by sharing needles during intravenous drug use. HIV can also be passed from mother to baby during pregnancy, birth, or breastfeeding. It is impossible to tell by looking at someone whether they are HIV positive, and not all HIV positive people know they are infected. That means regular testing for you and your partners can help you to detect HIV infection early so treatment can begin promptly. HIV transmission can be prevented by using condoms during sex. If your partner has been diagnosed with HIV, there are additional precautions that can be taken. For example, pre-exposure prophylaxis, or PrEP, which can block the virus from invading cells. However, the medication must be taken consistently to be effective. Post-exposure prophylaxis, or PEP, is an emergency medication that can be taken if you fear you have been exposed to the virus, for example, if the condom broke. This medication must be taken within 72 hours of exposure and must continue being taken for about 1 month. Practicing abstinence is the only 100% certain way to avoid contracting HIV. Being in a long-term, mutually monogamous relationship with an individual who is HIV negative is another fairly certain way of avoiding infection. There is no cure for HIV, but it can be treated with antiretroviral drugs. Antiretroviral treatments, or ART, can keep the viral load in the body low, so HIV cannot destroy the immune system. Additionally, antiretroviral treatments can help prevent an HIV-positive person from spreading the infection. If a person contracts HIV, they will have to take antiretroviral drugs and attend regular viral load monitoring appointments for the rest of their lives. Fortunately, however, contracting HIV is no longer a death sentence. Herpes simplex virus, also known as HSV or just herpes, is another virus that is transmitted sexually. There are actually 2 different strains of the herpes simplex virus, HSV1 and HSV2. Herpes simplex 1 causes oral herpes, in which cold sores and fever blisters appear around the mouth and on the face. HSV1 can be spread without sexual contact by sharing drinks, cosmetics, or kissing someone who is experiencing an outbreak. Herpes simplex 2 is responsible for genital herpes outbreaks, in which sores and blisters appear on the genitalia, for example on the penis or surrounding the vagina. Genital herpes is an extremely common STI. More than 1 in 6 people between the ages of 14 and 49 have genital herpes. Not everyone who is infected with HSV knows they have it, and some individuals may never show symptoms. Furthermore, an HSV-infected person can spread the virus even when they are not experiencing an outbreak. Therefore, it is imperative to protect yourself and your partner. Individuals with genital herpes should avoid any sexual contact with other people during an outbreak, because this is when they are most likely to spread the virus. Even when there is no outbreak, a condom should always be used during sex. Condoms do not completely protect the partner, however, since the virus can still be transmitted by contact of uncovered skin, even when sores or blisters are not present. A dental dam is a square piece of latex that can be used for protection during oral sex. If you and your partner are sexually active, it is so important to participate in regular STI screening so both individuals can be aware of their status. There is no cure for herpes simplex virus. People infected with HSV will have it for the rest of their lives. Treatments exist that help to prevent outbreaks and to reduce the severity and frequency of outbreaks. These medications can also help an infected person to reduce the risk of spreading the virus to others. Nevertheless, an infected individual can spread the virus even when they are not having an outbreak and even when they are using protection like a condom. If you are in a relationship with a person who has been diagnosed with genital herpes, you can reduce your risk of contracting the disease by making sure that your partner takes anti-herpes medication daily, by avoiding vaginal, anal, or oral sex while your partner is having an outbreak, and by wearing a condom or using a dental dam for any sexual activity when there is no outbreak. The only way to be completely sure that you will not get genital herpes is not to have any kind of sex, vaginal, anal, or oral. If you are sexually active, your chances of contracting genital herpes is extremely low if you are in a long-term mutually monogamous relationship with a partner who has been tested for STDs and who has negative test results for HSV-2. The last viral STI that we will discuss in this lesson is human papillomavirus, or HPV. There are over 150 different types of human papillomavirus. Most HPV types are not sexually transmitted and cause common warts on the skin of the arms, chest, hands, and feet. The other types of HPV are sexually transmitted and are spread through contact of the genitals and/or mouth through vaginal, anal, and oral sex. This virus can be spread even when an infected person has no visible signs or symptoms of the disease. HPV is the most common sexually transmitted infection worldwide. It is believed that just about every sexually active person will contract some form of HPV during their lifetime. Many people who contract HPV will never show symptoms, and their immune system will clear their body of the infection within 2 years. There are, however, some types of HPV that cause genital warts. While the virus itself cannot be cured, genital warts can be treated by surgically removing them or by freezing them off. If genital warts are not treated, they may go away as the individual's immune system attacks and clears the virus, or the warts may remain long-term, or warts may increase in size or in number. The types of HPV that cause warts are considered low-risk HPV. High-risk genital HPV infections do not cause warts, but can lead to cancer of the cervix, vulva, vagina, penis, anus, and throat. There is no cure for any forms of the HPV virus, but treatments exist for the cell changes caused by an HPV infection. Pre-cancer cells can be removed, and cancers of the throat, cervix, anus, and genitals can be treated through surgery, chemotherapy, and radiation therapy. These treatments are not always successful, however, and HPV-related cancers may lead to death. While the human papillomavirus itself cannot be cured, it is possible to avoid becoming infected in the first place. Since HPV is so common, the only 100% guaranteed way of preventing infection is to avoid contact of your mouth, anus, or genitals with those of another person. This means abstaining from vaginal, anal, and oral sex, as well as making sure that these areas of your body do not come in contact with another person's skin. Only by completely abstaining from sexual activity can you be totally certain that you will not contract HPV. Another precaution you can take to avoid HPV is to get vaccinated. The CDC recommends that all children should be immunized against HPV at 11 or 12 years old. All HPV vaccines protect against the two types of HPV that cause most cases of cervical cancer. Some brands of HPV vaccine also protect against the types of HPV that cause genital warts. If you did not receive the HPV vaccine at 11 or 12, the CDC still recommends the vaccine for young women through age 26 and for young men through age 21. You can talk to your healthcare provider to find out whether you have already been vaccinated or what your options are to get vaccinated if you haven't been already. If you are sexually active, you can reduce your risk of contracting HPV by limiting the number of sexual partners you have, and also by avoiding sexual contact with individuals who have had many other sexual partners. Condoms can offer some protection against HPV. However, the virus can still be passed from contact with skin that is not directly covered by the condom. Dental dams can be used for safer oral sex. Remember that HPV is extremely common, and it is spread by skin-to-skin contact, so you can contract it even if you only ever have one sexual partner and you use a condom every time from start to finish. There is no general test for HPV since the virus is so common and only a few types are considered high risk. The only HPV testing that is available is for women only, and it only tests for the two types of HPV that commonly cause cervical cancer. Therefore, it is impossible to identify which individuals have an HPV infection, even if they submit to regular STD testing. Again, HPV is very common, and most people do not show symptoms of their infection. The only way to completely avoid this virus is to abstain from all sexual activity. In addition to the viral infections like HIV, herpes, and HPV, sexually transmitted infections can also be caused by bacteria. The most common bacterial STIs include chlamydia, gonorrhea, and syphilis. Chlamydia is an infection caused by bacteria that often results in a green or yellow smelly discharge from the penis or vagina and a burning sensation when urinating. It is possible to have a chlamydia infection in the anus. This can occur either because the bacteria spread from the genitals or following receptive anal sex from an infected partner. The symptoms of an anal chlamydia infection often include rectal pain, discharge, and bleeding from the rectum. Oral sex with an infected partner can result in a chlamydia infection in the throat. This may result in a sore throat, cough, or fever. Usually, the symptoms of a chlamydia infection appear between 1 and 3 weeks after having vaginal, anal, or oral sex with a person who has chlamydia. Occasionally, a person may have a chlamydia infection but show no symptoms. It is important to note that a person can spread chlamydia even if they have no symptoms of an infection. If an infected person does not seek treatment for chlamydia, the disease can lead to serious health problems. For women, untreated chlamydia can spread throughout the reproductive system and cause pelvic inflammatory disease, or PID. PID can lead to long-term pelvic pain, an inability to get pregnant later on, or even ectopic pregnancy, a condition in which the baby begins growing outside the womb. Ectopic pregnancies are fatal to the baby and could also be deadly for the mother. Men with untreated chlamydia can sometimes experience pain in the genital area, as well as fever, if the infection spreads to the vas deferens. Rarely, an untreated chlamydia infection can cause a man to become infertile or unable to have children. These complications of chlamydia are easy to avoid with prompt treatment of a chlamydia infection. Because it is caused by bacteria, chlamydia can be treated with antibiotics. Antibiotics can be prescribed by your healthcare provider and may involve 2 doses daily for 1 week. It is important to take the full course of antibiotics as directed by your doctor, even if your symptoms subside before the full amount is taken. Stopping treatment before the course of antibiotics is complete may result in a return of the infection. It is important not to have sex during treatment, since you may still be contagious even if you no longer have symptoms. Ask your healthcare provider when it is safe to return to normal sexual activity. Remember that even if you have had chlamydia before and have been treated, you can still get chlamydia again, so it is important to take steps to protect yourself from infection. Like all sexually transmitted infections, the only way you can be completely certain of avoiding chlamydia is to abstain from vaginal, anal, and oral sex. If you are sexually active, you can reduce your risk of contracting chlamydia by using latex condoms every time you have sex. Since a man does not have to ejaculate or come in order to transmit chlamydia, the condom must be worn from start to finish to prevent transmission. Dental dams can be used for protection during oral sex. Being in a long-term, mutually monogamous relationship with a partner who has negative STD test results is another good way to reduce your risk of contracting chlamydia. Getting tested regularly for chlamydia can aid in early detection and prompt treatment. The CDC recommends annual STD testing for sexually active young people. Gonorrhea, also called the clap, is another sexually transmitted infection that is caused by bacteria. The symptoms of gonorrhea are very similar to the symptoms of a chlamydia infection. Symptoms may include a burning sensation when urinating, a white, yellowed, or greenish discharge from the penis or vagina, painful or swollen testicles, and vaginal bleeding between periods. Gonorrhea infections are also possible in the throat and anus. Throat infections are caused by having oral sex with an infected person and may result in a sore throat and pain when swallowing food. Rectal infections can result in anal itchiness, soreness, discharge, bleeding, and painful bowel movements. Oftentimes, individuals who have a gonorrhea infection will not show any symptoms and may not even know they are infected. For this reason, the CDC recommends annual gonorrhea testing for young individuals who are sexually active. Annual testing can help people who are asymptomatic to catch and treat their infection before it progresses to the point of causing serious or permanent health problems. Untreated cases of gonorrhea can cause pelvic inflammatory disease, or PID, in women. PID can result in long-term pelvic and abdominal pain and the buildup of scar tissue in the fallopian tubes that can cause ectopic pregnancies and infertility. In men, untreated gonorrhea can cause pain in the genital area and infertility. Sometimes, in either gender, a gonorrhea infection can even spread to the blood or joints, a condition that can be deadly. Since gonorrhea is caused by bacteria, it can be cured by taking antibiotics. However, more and more cases of antibiotic-resistant gonorrhea have been reported in the United States and around the world. Once a bacteria evolved to be resistant to antibiotics, there will no longer be effective treatments to cure them. To prevent the adaptation of antibiotic-resistant gonorrhea, make sure you take prescription antibiotics as directed by your doctor. Do not skip doses and make sure to finish the entire course of antibiotics, even if your symptoms subside before you complete the entire prescription. If you have been prescribed antibiotics for a gonorrhea infection and you do not seem to be getting better, return to your healthcare provider to be checked again. The doctor may be able to prescribe a different antibiotic that could potentially clear the infection. You should avoid having sex of any kind while you have a gonorrhea infection. Talk to your doctor about when it is safe to return to normal sexual activity. Immunity is not possible with bacterial infections, so you can get gonorrhea infections multiple times throughout your life, even if you have been treated before. The best scenario is to prevent gonorrhea infections in the first place. Since gonorrhea is spread through vaginal, anal, and oral sex, the only way to completely avoid infection with certainty is to practice abstinence from all forms of sex. Any sexually active person can get gonorrhea by having unprotected sex. If you choose to be sexually active, you can lower your chances of contracting a gonorrhea infection by committing to a long-term, mutually monogamous relationship with a person who has tested negative for gonorrhea. You can also use condoms every time, the whole time, to avoid contracting the disease. Dental dams can be used for protection during oral sex. Annual STD testing is also helpful to detect asymptomatic cases of gonorrhea so that they can be treated before the individual spreads the infection. Syphilis is the last bacterial infection we will discuss in this lesson. Syphilis is spread by direct sexual contact with an infected person. Transmission can occur during any type of sex, including vaginal, anal, and oral sex. A syphilis infection is divided into stages that each has its own set of symptoms. Stage 1 of an infection is called primary syphilis. Symptoms appear 3 to 90 days after exposure and include firm, round, painless sores called cankers that occur on or around the genitals, around the anus or inside the rectum, or in and around the mouth. These cankers can make a person more likely to contract other STIs, like HIV, since the sores make it easier for germs to enter the body. If the infection is not treated in the first stage, syphilis will progress to the next phase. Secondary syphilis emerges 4 to 10 weeks after the initial infection and includes sore throat, fever, swollen lymph nodes, achy joints, and a rash on the skin that is not typically itchy. Syphilis is most contagious during the first 2 stages of infection. However, symptoms of primary and secondary syphilis may be mild and can go unnoticed. If treatment does not occur, syphilis can enter a so-called latent phase, during which there are no symptoms. This phase can last for years. The infected individual may think they have recovered, but unfortunately, the bacteria is still at work in their system, and they are still capable of spreading the disease. The final stage of a syphilis infection is called tertiary syphilis. This phase occurs 3 or more years after the initial infection and is the most destructive phase of a syphilis infection. Tertiary syphilis affects many systems in the body, including the nervous system, circulatory system, and skeletal system. Neurological symptoms of tertiary syphilis may include headache, altered behavior, difficulty with muscle coordination, paralysis, dementia, vision changes, and even blindness. Damage to the circulatory system may include inflammation of the aorta, which could lead to aortic aneurysm, and an increased risk of aortic rupture and massive internal bleeding. Additionally, soft tumor-like balls of inflammation called gummas can appear on the skin, bone, and liver. Tertiary syphilis is no longer contagious and can be cured with antibiotics. However, any damage that has already occurred during the tertiary phase is permanent. If left untreated, tertiary syphilis can be fatal. Treating syphilis is actually quite simple. Since the infection is bacterial, syphilis can be cured using antibiotics. If you are being treated for syphilis, it is important not to engage in sexual activity until you have completed the series of antibiotics and your doctor tells you it is safe to resume having sex. Unfortunately, the symptoms of syphilis can go unnoticed, and unless the individual participates in regular STD testing, the infection can progress through all the phases and lead to death. For this reason, the CDC recommends syphilis testing once per year for sexually active individuals. Even simpler than curing a syphilis infection is not contracting syphilis in the first place. The only way to be 100% certain of not contracting syphilis is to practice abstinence from all sexual activity. If you are sexually active, use a condom during any type of sexual contact to prevent the spread of syphilis.
Okay, there we go. That is the complete video for this lesson, sexually transmitted diseases. Now let's go back to the questions earlier. After watching the full video, I believe all of you now could answer these questions. Let's read the questions again just to summarize things up. So you name some common STDs and you describe how do these diseases spread. And the second question, although anyone who's sexually active can get an STD or sexually transmitted diseases, certain behaviors can put people at a higher risk. What are they? What are some behaviors that can reduce the risk? And what's the only behavior that can eliminate the risk? So all of the answers to these questions were clearly highlighted in the video presented to you. So once again, if you want to answer these questions, just type your comment in the comment box below. Okay, let's proceed. You may also download the instructional learning material uploaded in our unit. You could also read the concept digest just to check the details of the topic presented. After which you answer the activity. It's titled Name Me. Please read and follow instructions carefully. Everything is written in the instructional learning material posted. You also have to answer the assessment for your summative. It's titled Abby's Story, and once again, you need to read and follow instructions carefully. So that's it for this week's lesson. Thank you for listening and have a good day, everyone.